So revision of reconstructed breast is a confusing term because it almost makes it sound as though something went wrong with the original surgery and so now a revision is necessary. When we talk about revision or revising the reconstructed breast in a breast cancer patient, what we're talking about essentially is shaping the breast. So it's not that anything's gone wrong, although there are certainly patients who come to Park Meadows Cosmetic Surgery seeking revision of their previously reconstructed breasts. These might be women who have had breast reconstruction years ago or decades ago who are just unhappy with the overall shape, appearance of their breast, the size of their breast, or how the reconstructed breast fits in clothing or in a bra. And so those are patients where numerous different techniques can be used to reshape the breast to create a more aesthetic, natural appearing reconstructed breast. Almost everybody who undergoes a breast reconstruction, every woman who has a breast reconstruction after mastectomy will need a series of revisions to achieve an ideal shape, contour, and volume of the breast. So these are normal procedures, not complications per se, but a normal part of the breast reconstructive process. The revision of reconstructed breast can use a variety of different techniques, from directly excising or using incisions to shape the breast to more non-invasive techniques using contouring or liposuction type of techniques, or even moving tissue from one part of the body or one part of the breast to another to add volume to one area that's lacking or to remove volume from an area that has excess. So different techniques are used and each person will be different. And so the best way to determine what technique would be used in you is to have a consultation here with one of us at Park Meadows Cosmetic Surgery to determine how we could improve on the shape of your reconstructed breast. The recovery for the revisions is relatively limited. For most patients, it's going to be a week or so, with the bulk of the recovery being in the first 3 or 4 days. Certainly, it depends on which technique is used and whether tissue is being taken from another part of the body and moved to the breast area to add volume or to shape the breast. But in most patients, they'll find that the first 3 or 4 days after surgery is the bulk of the recovery. And by the end of the first week, most patients are back to most of their normal activities. Recovery is always a spectrum. It's important to understand that there's patients who are quicker or patients who are slower on that continuum of recovery. But in general, this is a fairly quick and efficient recovery for patients.